All right, let's talk about suppositories. If you're a pharmacy student, you're going to want to stick around for this. We're going to skip the fluff and get right to what you need to know for your exams. We're talking definitions, types, and especially those all-important quality control tests that make sure these things actually work and are safe.
Okay, so let's set the stage. Think about it. You've got a patient, maybe a little kid, maybe an elderly person, maybe someone who's unconscious or can't stop throwing up. They need medicine, but swallowing a pill, not going to happen. So what do?
Well, that's where the suppository comes in. It's actually a pretty clever solution to a really tough problem, right? It can deliver meds for a local effect or even get it into the whole system. Okay, let's really get into the details here.
First things first, what exactly is a suppository? Well, the official definition is it's a semi-solid dosage form you pop into a body cavity. But here's the important part, the whole point. It's designed to either melt from your body heat or just dissolve in the body's fluids. And when it does, bam, the medicine gets released right where it needs to be.
You know for sure this is going to be an exam question, pros and cons. So the biggest pro, it's that it dodges the liver's first pass effect. And what that means is more of the drug gets into your system because the liver isn't breaking it down first. It's a huge deal for bioavailability. But of course, there are downsides. Let's be real, they can be uncomfortable for patients. And you've got to store them right, usually in the fridge, so they don't melt before they're supposed to.
Okay, Section 1, Types and Bases. This is all about the building blocks, how we classify them, and what they're made of.
So classifying them is actually super simple. It's just based on where they go. Now, for your exams, you have to know the special names. Pessaries, that's for vaginal use, and bougies, that's for the urethra or even the nose. Yep, there are even ear suppositories.
Okay, so you've got the drug, right? But what's the other most important part? It's the base. The base is like the car that delivers the passenger being the drug. It gives the suppository its shape and, this is the key part, it controls how that drug gets released. Let's look at the three main types you gotta know.
This is such a great summary slide. Look at the mechanisms. Fatty bases, like cocoa butter, they melt. Water-soluble ones, they dissolve. That's a key distinction. Now, for your exams, zoom in on those disadvantages. Cocoa butter's big problem is polymorphism. It can solidify in different ways, and that messes up the melting point. Total nightmare. The water-soluble ones, they're hygroscopic, meaning they pull in moisture, which can be irritating, and those synthetic bases, they can get so runny when they melt that the drug just sinks to the bottom. Not good for an even dose.
All right, Section 2. Now we're getting into the nitty-gritty, how these things are actually made. We'll cover the most common method and a calculation you absolutely, positively have to get right. This is where the rubber meets the road.
The method you'll see most often is called pour molding, or the fusion method. And honestly, it's a super simple 4-step process. You just melt the base, mix in the drug, pour it into a mold, and then let it cool down. That's pretty much it. It's a great way to make sure they're all nice and uniform.
And here's what those molds actually look like. They're usually metal or plastic, and you can see they've got all these little cavities, so you can make a whole batch in one go. You just pour the liquid in, let it get hard, and then crack the mold open to pop out the finished suppositories.
Okay, everyone, listen up. Displacement value. This is a huge deal for exam calculations. It sounds complicated, but it's not. Imagine a glass filled to the very brim with water. If you drop a pebble in, what happens? Water spills out, right? The pebble displaced the water. It's the exact same idea here. The drug is the pebble, and the base is the water. The drug is denser, so it pushes some of the base out of the way. We have to calculate this to make sure the final weight is right and, more importantly, that the dose of the drug is perfect.
You know, the best way to get this is to just do an example, so let's work through one together. We're trying to find the displacement value of zinc oxide in a cocoa butter base. We've got the weights, so let's walk through it.
Okay, step 1 is just figuring out what we're working with. We know that 8 plain, base-only suppositories weigh 8 grams. Simple enough. But the ones with the drug in them, they weigh more, 11.74 grams. So from that, we can figure out exactly how much of that weight is the drug, the zinc oxide, and how much is the base.
And here's where it all comes together. Step 5 is the key. We figure out how much base got pushed out of the way. We started with 8 grams of base, but we ended up with only 7.044 grams. So that difference, that 0.956 grams, that's the amount of base the drug displaced. Then it's just a simple formula. Divide the weight of the drug by the weight of the base displaced. And there's our answer, 4.912.
Okay, so we've made them. Are we done? No way. Now we have to test them. Section 3 is all about the crucial evaluation tests. And let me tell you, this stuff is always on exams, so you're going to want to know these tests inside and out.
So here's a quick look at the main tests we're going to cover. We're checking everything, from what they look and smell like, to making sure they're all the same weight, to seeing how they hold up at body temp and release that all-important drug.
When you think weight uniformity test, I want this number to pop into your head, plus or minus 5%. That's the magic number. Remember this percentage, and you've got the key to one of the most basic but critical QC tests.
So what's the official rule? I mean, according to the Pharmacopoeia, the big book of drug standards, well, you take 20 suppositories and you find their average weight. Here's the deal. None of them can be more than 5% off from that average. Well, almost none. They give you a little wiggle room. 2 of them can be off by up to 7.5%. It's a really tight standard, and it's all about making sure every single dose is consistent.
Next up, we've got the break-in test. This is all about mechanical strength. I mean, think about it. A suppository has to survive being packaged, shipped across the country, and then handled by the patient. If it just crumbles in their hand, it's totally useless, right? So this test basically sees how much pressure it can take before it snaps.
And this test, the melting range test, is all about making sure the suppository does its job once it's in the patient. Especially for those fatty bases. They have to melt to release the drug. So we test that by putting them in a water bath at 37 degrees Celsius, which is, you guessed it, human body temperature, to see if they melt like they're supposed to.
All right, let's bring it all home. Section 4 is a super quick recap of the absolute need-to-know points for your exam. If you're cramming, these next 2 slides are your best friends.
Think of this as your first exam flashcard. You need to have these 5 things on lockdown. You should be able to define suppository in your sleep, know that a pessary is for the vagina and a bougie is for the urethra, explain that whole polymorphism problem with theobroma oil, and nail that 1-sentence definition of displacement value.
And here's your second flashcard. This is all about the evaluation tests that you're almost guaranteed to see on the exam. Know those plus or minus 5 and 7.5% rules for weight uniformity. Remember what the breaking test and melting range test are for. And don't forget that fusion, or pore molding, is the #1 way these are made. So I'll leave you with this question to chew on. We've talked about tests for dose accuracy, for physical strength, for how the drug is released. When it comes down to patient safety, which one of those tests do you think is the most important? The one we absolutely can't skip. You could make a case for any of them. Think about it. Thanks for tuning in, and good luck on those exams.